Dr. Camille Ronisi here with Ascend Physical Therapy. I am not in my clinic today. I am home because I broke my ankle. And this experience really brought home for me some of the tricks of the trade that I picked up specifically from my time spent working in inpatient rehab. So when you work in inpatient rehab, you help people who have multiple broken bones or a stroke or spinal cord injury or brain injury. So you're doing a lot of teaching people how to function again in this new body, whether it's a body that will one day heal or it's a body that will never be the same again. And there's some really critical parts to that. The foundation of inpatient rehab is helping people move in bed, transfer from one surface to another, stand up and walk and do stairs, right? So that would be like the most basic explanation of what you should know to get through your life on a physical level. Obviously, inpatient rehab is a lot more complex than that. Coming home in a cast with crutches is a lot more complicated than that. But the foundation is there, and I'm going to tell you the tricks that help you master this foundation. Trick number 1, mental health. There is never a time in your life where your brain is not connected to your body. So if your rehab plan, if your coming home injured plan does not include an element of taking care of your brain, you don't have a complete rehab plan. So your mental health can be handled a couple of ways. And remember, I'm not a counselor, I'm a physical therapist, but I can tell you that some of these things come straight out of coaching people, come straight out of years working in fitness with endurance athletes, come straight out of all the skills we learned as physical therapists to help people stay motivated to exercise. Laughing, grieving, having autonomy, having clarity, those are all things that are really critical to someone feeling like they are on the mend, okay? You gotta find a way to laugh. You gotta find a way to laugh. I don't care if it's a bad joke or a dumb movie. Find something to laugh about. If you can get to a point where you can start telling really bad puns about your own injury, you're gonna be just fine, right? Because you have figured out how to take ownership of your situation and to not let it get you down. But it will get you down, and that's okay too. So you get to grieve. You get to have your pity party. I have worked with plenty of patients who need some time to pity themselves. You need to do that. You need to cry. You need to cuss. You need to yell. You need to fuss. You need to bitch about it. You need to tell someone, this sucks. And they should turn back to you and go, yeah, this does suck. I'm really sorry you're experiencing this. How long do you want that pity party for? You define it. If you need one whole day, you need a whole day. If you need 5 minutes, you need 5 minutes. You can have your pity party, but you gotta put a curfew on that thing. Put an end point on it. And then find a way to laugh, right? Look for clarity. Ask questions. Get answers. Do you want to know the exact structures that were damaged? Find out. Talk to your physician. Talk to your physical therapist. Get information, right? What's normal for this? What's not normal for this? What are the other risk factors on the table that I should be thinking about? What do I not need to be worried about? When I walk into somebody's room, I cannot tell you how many times in the hospital I've asked someone, tell me what you know about your injury. Tell me what you know about that pain you're experiencing. And they'll say, not much, I don't know. I just know that it hurts. Well, they don't know why it hurts. They don't know anything about their pain. Pain loves when you know nothing, because the less you know, the more scared you are. The more scared you are, the more pain you experience, right? The more you know, the more clarity you have, the more power you have over your own body, because now you know where your boundaries are. When you know your boundaries, you have the power to make decisions. When you know nothing, you have no power. So clarity is really important for mental health and physical health. So that's my number one goal when I work with people, and that was my number one goal for myself coming home, is figuring out what I needed to do to feel like I was somewhat normal and somewhat in control. Now, the actual moving part. When you work in inpatient rehab, your job is to help people move in bed, get out of bed, transfer to a toilet, stand up, walk, do stairs. That's more or less the foundation of what we do, with a whole lot of subtlety in there. So the point being, we want you, physical therapists want you to flipping move. If you are 100% totally dependent and you are in bed and you basically can't roll, then your moving is going to be breath work. You are going to practice breathing and flexing muscles, whatever muscles you can flex. You've got something that can flex. I don't care if it's that you can make facial expressions. You're going to move something. Move. I have one foot that is broken. 3/4 of my body is totally fine. So I have the capacity to get up and move. So I'm going to find ways to do it, right? That's not just for mental health, although it helps. It's also for my physical health and my healing. Nearly all the research out there shows that exercise improves healing on multiple levels. Exercise is good. Move. But if you're going to move, let's move to our next lesson. Safety first. Always safety first. I call it checking the scene for safety, right? When we are working in a hospital and we step up to a bed and we say, okay, like Mrs. Jones, we're going to move from the bed to the wheelchair. Mrs. Jones will not be moving from the bed to the wheelchair until I am certain that everything around me is set up for her success. Brakes are locked. There's nothing for her to trip over. I have the help that I need if she needs extra help. Safety belts. The bed is right. Like she's got her pants are tied securely. So even me, right? Like with this broken ankle, I have to consider safety first, right? So when I come home from the hospital with this bad boy on and it's late at night and they've given me pain medicine and I'm expected to just crutch around, you better believe I didn't move unless I had somebody nearby, because I didn't know if I was going to be dizzy. I didn't know in the low light fatigue situation with my tired ass brain, having gone through all this trauma, if I could keep my balance. So there was somebody with me when I moved. After a day or two, especially in the broad daylight and I was wide awake and not in as much pain, I felt confident crutching around. But the first time I did the stairs, somebody was with me. To tell you the truth, a week and a half later, I don't do the stairs unless somebody is with me. Because just in case. I don't really feel like being a patient in the very hospital that I work in. Not because I don't love them. I love them. I just don't want to be a patient in the hospital. So safety first. Like there's no loss in dignity for taking an extra minute to make sure that you are safe and that whoever's helping you is safe so that nobody gets hurt more. Which means the final, very critical, important thing is that transfer skills are everything. And when I say transfer, I mean getting up off the couch, moving from a bed to a wheelchair. How do you stand up with crutches? How do you get on a toilet? Probably the number one transfer skill to learn is how to get on and off a toilet with all this gear and these limitations. Transfer skills are everything. Which means we get down to my most favorite skill to learn. It makes the biggest difference, and most of the time you're not going to learn this in the emergency room, is butt first. It's always the butt first, right? When you go to sit down, you plant yourself in front of your chair and your butt starts to move to the chair. When you go to stand up, it's your butt that comes off the chair first. If you need to move from your bed over to a wheelchair, you move your butt first. Your feet should not go first. It's not going to work well. So that was a lot of things to say. But knowing all those things helped me come home safely. And I want everyone to come home safely. So let's say them again. Mental health. Move whatever you can as much as possible. Do it with safety first. Figure out how to transfer safely by using your butt. You got this. Here we go.